name is Ashley Brochu with Palm Beach State's Bachelor of Science Nursing Program, here to perform an abdominal assessment on Mr. Bear. Okay. In a normal acute care setting, the patient would be in a gown and then a sheet draped over them for privacy reasons. I would also perform hand hygiene prior to assessing my patient. Okay. So we begin our assessment with inspection. The patient's gown is lifted up and then a sheet is over their genital region for privacy. You begin with inspecting the abdomen. You look for symmetrical rising, you look for any bulging masses or lesions, observe for any striae, any wounds or scars. You observe the umbilicus, make sure the skin color with the umbilicus is within normal limits regarding to the whole abdomen, and the umbilicus should also be midline and inverted. Okay. The next step is auscultation. You're going to auscultate about all four quadrants of the abdomen, and then we will also listen to the arteries for any bruits. So you begin with listening in the right lower quadrant. Okay. Normal bowel sounds are 5 to 30 clicks or gurgles per minute. Anything hyperactive would be more than that. Okay, the next thing we do is listening to the arteries for any bruits. You flip over to the bell of your stethoscope. Listen to the aorta, then the renal arteries, and the iliac arteries, and last the femoral arteries. In a normal setting, you will not hear any bruits. Bruits are indicative of turbulent blood flow caused by dilation or a tortuous vessel. The next thing we do is we percuss the abdomen. We're going to use the middle finger of our non-dominant hand and place it on the patient. And then with your dominant hand, you're going to use your middle finger and percuss lightly on the abdomen. Over the abdomen, you will hear mostly tympanic noises. When you get to over the solid organs, you will start to hear dullness. You assess for any tenderness upon palpation or upon percussion with the patient. Okay. No tenderness noted upon percussion. Next step is to percuss the liver. You start with the mid-clavicular line and you assess the intercostal spaces. When you start to hear dullness, you mark that with a marker. That'll be the top of your liver. So once you mark that, you'll start from the bottom on the right mid-clavicular line and you work your way up. You'll hear the tympany until you hear dullness again. You mark that and that'll be the bottom border of your liver. Normal liver can be between 6 to 12 centimeters. Okay? And then we move on to palpation. You lightly palpate the abdomen. Again, noting any bulging or masses. You want to document if you find any of those. You also want to assess for any tenderness when you lightly palpate the abdomen. No abnormalities were noted. Next step we move on is to deep palpation. So you're going to take your fingers and push about 5 to 8 centimeters in. Again, noting any tenderness, masses. Okay. And then moving on from here is when we're going to palpate the spleen. So place your right hand underneath the patient. I'm left-handed. And with your left hand, firmly ask the patient to take a deep breath. And with your hand, you're going to hook it under the intercostal margin. Normal liver, you feel the bottom of it. If the liver is enlarged, you will feel more. Okay, that would be indicative of cirrhosis or liver cancer. Okay, then we go on to palpate the spleen. So the same thing, place your right hand underneath the patient, ask them to take a deep breath. Then you palpate deep under the left intercostal margin. A normal spleen is not palpable. If you can palpate the spleen, you would be looking and worried about splenomegaly. All right. You also want to ask the patient to sit up so you can test for any tenderness with the kidneys. So with the patient sitting up, you'll put your non-dominant hand underneath the costal margin and you'll just push. And then you'll go over to the left side and punch again. Okay. If there is any tenderness noted with this, it can be indicative of a kidney infection or kidney stones. All right, so that is it for the abdominal assessment with Mr. Bear. Everything was normal.